Hello, my name is Marian Karpinski. I'm a registered nurse and I'll be your host during this program. Medications play a major role in healthcare and when used properly can improve our quality of life. When medication is used improperly, the result may be falls, broken bones, motor vehicle accidents, and illness. In this presentation, you will learn the warning signs of improper medication use and how you can help to manage medications. You'll also learn safe practices for dispensing and giving medicine. People who are 65 years of age or older take 30% of all prescription drugs sold in the United States and 40% of drugs sold over the counter without a prescription. The older adult will often have several chronic illnesses occurring at the same time. One person could have arthritis, diabetes, high blood pressure, and kidney disease, and each illness will require its own medication. The elderly take an average of 8 different medications a day. The more medication a person takes, the greater the chance of falls, medication errors, and drug interactions.
The body changes as we age in terms of how we absorb, how the drugs are distributed through the body, and also how we eliminate the drugs. Absorption is affected by changes in the stomach acid. For instance, as you age, there's less acid in the stomach, and the motility, the speed with which medication travels through the intestine, is reduced. This will slow the absorption of medication and affect its delivery to the organs which it is intended to affect. The other things that change as we age is the body composition changes. Muscle mass is converted to fat as we age. And fat-soluble drugs can be stored in the fat, which may increase the risk of adverse effects or toxicity. Then finally, the kidneys and livers change as we get older and metabolize and eliminate the medications at a slower rate than previously. This will increase the risk of toxic reactions as well.
We know our body changes as we age, but the rate of change may be different from one person to another. So the response to medication is varied. Another point to consider is that drugs are tested and developed for a younger, healthier age group, yet most of the drugs are taken by the chronically ill, older population. So the response is varied and may be unpredictable. As a caregiver, it's important to be aware of the possibility of medication problems in the elderly, and for you to report any unusual symptoms to the doctor. A side effect is a well-known expected response to a medication. For example, the side effect for antihistamines is drowsiness. If a side effect is severe and long-lasting, or if it interferes with the ability to function, it should be reported to the doctor. A side effect is different than an adverse reaction. An adverse reaction is any new, unusual, unexpected response to a medication. Adverse reactions may occur when food interacts with medicine. For example, dairy products interfere with the absorption of tetracycline. Adverse reactions may occur when one medicine interacts with another medicine. This is called drug interaction. The risk of drug interaction increases with the number of different drugs taken. Most people do not view over-the-counter drugs, alcohol, caffeine, and natural herbal products as drugs. These are drugs, and when combined or used with prescription medications, can cause adverse reactions. It's best to use only one pharmacy that has your medication history. A pharmacy that can computer track all medications will reduce the chance of adverse reactions. Call your doctor if you observe an adverse reaction to medication. Is there a change in mental alertness, such as difficulty concentrating, forgetfulness or confusion, unusual swelling or rash, fainting or extreme weakness, tremors or stiffness, gastrointestinal problems such as indigestion, constipation, diarrhea, or vomiting? There may be a loss of bladder control or difficulty urinating. Call the doctor if there is a visual or hearing problem, such as blurred or double vision, loss of hearing, or ringing in the ears. If an adverse reaction should occur, write down what happened so that you can report it accurately to the doctor. Some adverse reactions take time to develop. Symptoms such as depression, confusion, or forgetfulness develop slowly over a period of weeks and months and should be reported to the doctor. Sometimes people ignore symptoms such as weakness, depression, fatigue, and confusion in the elderly because they think that it is just part of growing old, when in fact it may be due to an adverse reaction from medication. Over-the-counter drugs, when combined with a prescription drug, may change the effect of the prescription drug, making it stronger or less effective. Over-the-counter drugs may mask the symptoms of a problem. For example, taking antacids repeatedly for an upset stomach could delay the diagnosis and treatment of ulcer disease. Check with your doctor before giving or taking any over-the-counter medications. When you visit the doctor, hospital, or emergency room, bring a list of all current medications. If you don't have a list made up, use the brown bag approach and bring the medications with you. Your list or bag should include nutritional supplements, vitamins and minerals, herbal or natural medicines, ear or eye drops, inhalers, suppositories, ointments, injections, and over-the-counter drugs. Remember that alcohol, caffeine, and nicotine are drugs as well. Be sure the doctor is aware of any drug or food allergies, special diets, and medical history, such as kidney or liver disease. If the doctor prescribes a new medication, it's important for you to ask questions. Have a pen and paper ready to write down the answers. You may not remember everything when you get home. The first question to ask your doctor is the drug's generic and brand name. Can the medication be prescribed in the generic form?
The difference between generic name and brand name for drugs is that the generic name is the common name that every manufacturer uses for a specific drug. But a brand name is a trade name or trademark name that one specific manufacturer calls that drug. For instance, a generic name is aspirin, but a trade name might be Bayer aspirin or Anacin or a specific product. In choosing a specific drug, check with your doctor to make sure that the generic name is okay. There are differences in the products, and your physician may want you to have that specific brand name rather than the generic name.
Other questions to ask your doctor are, what is the medication supposed to do? Have the doctor write the purpose of the medication on the prescription. How do I give the medication and how much? For instance, if it's an ointment, how much should I apply? When and for how long should this medication be taken? What foods need to be avoided? Is the medication taken on a full or empty stomach? What are the side effects, and what do I do if they occur? What side effects should I report immediately? Should alcohol be avoided? What activities need to be avoided? What do I do if a dose has been missed because it has been vomited, refused, or forgotten? When you pick up the prescription, ask the pharmacist to write out complicated directions. A pharmacist can help with scheduling medications to fit you and your family's lifestyle. Your pharmacist can also help you with the timing of the medicine. For instance, if the medicine needs to be taken on an empty stomach, ask the pharmacist how long after a meal you should wait before taking the medicine.
There are two basic types of enclosure caps for your prescription. One is a flip-off cap, and if you have no children living with you or no children coming to visit you, the flip-off cap is the most convenient for most people in most homes. However, if you do have visitors coming from outside, or if you have children living with you, always request the push-down turn kind of cap that we call a safety cap. The pharmacist is obligated to ask you, indeed, if you would prefer a lock cap or a flip cap.
The pharmacist is a resource of information. If you weren't able to ask the doctor about the new prescription, ask the pharmacist. When you leave the pharmacy, check the label to be sure it's correct. If you're refilling medication and the prescription looks different, such as a different color, size, or shape, ask the pharmacist why before you give or take that medication. Wash your hands before you begin to prepare and give medication. This will reduce contamination. To lessen your chance of error, avoid distractions and have adequate lighting. Check the medicine's expiration date, and if it is outdated, discard it. Check with your pharmacist for the safest way to dispose of the medicine. Do not give medication from unlabeled containers. You can't be sure of the type of drug you are giving or the proper dosage. Check the medication label for the correct name and the correct dosage of the drug before removing it from the container. Always ask yourself the 5 R's. Is it the right medication, the right person, the right dose, the right route, and the right time? After you open the container, look at the medicine. If it is discolored or has an unusual smell, do not use it and check with the pharmacist who can direct you. When you remove medicine from its container, use a spoon to avoid touching it or drop it into the cap. Then put the medication into a cup or small saucer. Read the label once more before returning the prescription bottle to the shelf. When you give the medicine, you can use the spoon to place the medicine in their mouth or hand them the cup and let them take it on their own. Stay with them until they have taken the medication. If the doctor has asked you to keep a record of the medications given, set up a system for recording the date, name of the medicine, dosage, and time. It's best to record this information right after you have given the medicine. Always watch for signs of side effects or unusual reactions to medications and report those to the doctor.
It's very important that you take your medication as prescribed by your doctor. You shouldn't increase or reduce the dose without consulting with the doctor. If you miss a dose, you can check with your doctor or a pharmacist to see whether you should double up on the next dose or not. Once a year, your primary care doctor should review all your medications, including those prescribed by other physicians caring for you. Over-the-counter medications, vitamins, natural herbal remedies, all these should be reviewed by your doctor.
Water is the safest liquid to use when giving oral medications. Milk and some juices can interfere with absorption. If the medication can be crushed or needs to be split, there are pill crushers and pill cutters available at most drugstores. Don't chew, crush, or break any capsules or tablets unless you have discussed this with your pharmacist. Some people have difficulty swallowing pills, and it helps to mix the medicine with a small amount of food. Check first with the pharmacist, and if the medicine can be crushed and mixed in food, a tablespoon of applesauce works well. Remember, they need to eat the entire amount to be sure they are getting all of the medication. Many liquid medications need to be shaken. Check the label for directions. Hold the medication cup at eye level while pouring liquid into it. Pour liquid medications with the bottle's label facing upward. This helps to keep the label clean and easy to read. Use measuring spoons. Avoid household spoons. If a liquid medication comes with a calibrated spoon or cup, it should be used with that liquid medication only. Sublingual medication is taken beneath or below the tongue. Medication that is placed sublingually is absorbed through the lining of the mouth. Place the tablet under the tongue and let it slowly dissolve there. Do not chew or swallow the tablet. Do not swallow until the tablet has completely dissolved. Ointment should be applied as directed and not too thickly. Apply cortisone cream and ointment in a thin film. Wear gloves to protect your hands. For smaller areas, you can use a cotton-tipped swab. Remove the old skin patch each time you apply a new one. Unless your doctor tells you to reuse the same area, apply each patch to a new area. Choose a skin area that is not hairy, oily, irritated, broken, scarred, or calloused. Patches should be applied at the same time each day. Wash the new area thoroughly with soap and warm water, then dry it. Wash your hands before applying the new patch. Remove the protective backing. Try not to touch the exposed medication. Press the sticky side of the skin patch firmly against the skin. Make sure there is good skin contact at the edges of the patch. Press firmly into place with your palm for at least 10 seconds. Wash your hands thoroughly with soap and water to remove any medication that may have gotten on them. To place a rectal suppository, have the person lie on their side with the top leg bent at the knee toward the chest. Wear gloves to protect your hands. Squeeze some water-soluble lubricant on the rounded tip of the suppository. Be gentle when inserting into the rectum, and insert past the sphincter muscle, gently pushing the suppository against the wall of the rectum. Suppositories generally take 15 to 30 minutes to work.
Inhaled medications can be provided to individuals in one of two primary ways. The first way is called a medication nebulizer. This device is driven by compressed air or gas through this line. Medication is placed in the bowl. The gas then causes the medication to be misted, and particles of medication comes out of this mouthpiece. The individual would hold the mouthpiece into the mouth for up to 15 minutes, breathing normally, occasionally inhaling deeply and holding their breath, until all the medication was discharged from the bowl. The second way of delivering inhaled medications is with a device called the metered dose inhaler. This device consists of a canister that is pressurized, and when you compress the top of the canister, it provides a misted medication that then the individual can inhale into the lungs. In order to use the device properly, it requires certain criteria. First off, the individual has to be able to take a deep breath in. They have to be able to hold their breath for several seconds.